Hi, everybody. This is Dr. K from Wholistic Minds. It is my privilege and honor to be introducing Dr. Benjamin Shield with you. He is an amazing craniosacral therapist, healer, and teacher. And that's why I feel so honored, because he's the one that's actually teaching so many other people to practice his art. And he has so much wisdom to share. And I'm just really excited that he's here. Thank you, Dr. Shield.
Well, it's a pleasure to be with you, Doctor. Thank you for letting me share on this subject.
Of course, of course. Well, you've got a really interesting story, because you didn't get into this immediately. You were actually in dental school, in a very prestigious dental school, and you decided to jump ship. What happened, and how did your heart get touched to move you in this way?
Actually, it got touched almost 50 years ago. I was going to a small experimental college in Sarasota, Florida, a new college, in 1971. And Ida Rolf was living close by, and some of her students percolated onto this campus. There were only about 325 students at the time. And being a child of the 60s, I'd gone through a lot of different body works and different processes, and there was a certain New Age fatigue. So I let other people experience the work, and I was watching, and it was almost as if they were coming alive, like a forest that was just, where the trees were just beginning to come alive. People were just moving differently and experiencing life differently. And then during spring break, I had my first 3 sessions, and that was transformational. How I just changed how I moved, how I breathed, how I interacted with life. Then when it came time to decide what to do with my life, it was between Rolfing and dentistry. And I chose dentistry because I thought it was safer. And I got through my 3rd year and realized my heart was really in what I'm doing now. And they thought I was crazy. I chose Boston University because it was a class of just 38 students. And I did a year of research. They offered me a federal grant, and I decided not to return. I went into the Rolfing training, and this is almost 40 years ago.
Wow. So this was really a calling.
It was a calling, and I'm so grateful for it.
Wow.
I love it each day.
Can you expand on what it is that you said in terms of what you felt after you got the treatment? Because I think for a lot of people, they're like, wait, what? It's almost like those kinds of things are not possible. What was your experience with those first initial treatments, getting the Rolfing? And then can you explain to our audience what Rolfing is?
Well, yes. And I could put it in very antiquated terms, in that back in 1971, we actually had to get up from the couch to change channels on the TV set. And just that movement, those simple movements, I felt like a jaguar. I felt every muscle in my body working together. It was once described, I forgot the body of literature, but an author described a character as living just a short distance away from his body. And I think one doesn't realize it until one is offered the chance to be inside one's body, to be really incorporating that sense of physicality and blending it with the other aspects of life. So I fell in love with it. And just walking down the street was different. I just wanted people to see me because I was moving so differently, and I felt so great. And back then, money was, funds were at a premium. So whenever I could scrape together funds to get a session, it was just a great experience. And I still feel the same way today. I think that as we mature in life, the sessions mean more in different ways at different times of our lives.
Well, it's really interesting how you said that, because what I hear from a lot of parents whose children get similar kinds of treatments is that they're blissed out. The children are relaxed for the first time. The children are smiling. They want to go back to get the treatment. So it genuinely does help us reconnect with our body and just help us feel good in our own body.
And I think with children, particularly with children, but adults as well, one of the goals, the very first goal before we think of doing anything clinical with our hands, is to establish trust and safety. Because so often if a child is brought in, they have a clinical condition. And so there's that to deal with. But because of that condition, they've often seen a myriad, a whole chain of medical interventions. And they may have lost their sense of trust and safety. So that's the primary goal before we do anything clinical with our hands. And ultimately, I think if we were to make a list of all the different goals we would have, the main goal would be creating choice in movement, in emotional response, in the ease of body, and how the choices we have in dealing with life. Often because of the intensity of the birth process or injuries along the way or emotional situations, that choices can become limited. It's almost like tearing pages out of our dictionary. And so one of the main goals through gentle touch and presence and empathy is to reestablish that repertoire of choice.
And when you say choice, I mean, people are thinking of this psychologically, and we'll get into how the psychological connects with the physical. But in a way, by opening up the body, by restoring the fluidity and function of the body, we allow the body to have a freedom in a way.
Yes.
Is that kind of what you do and what others you have taught do?
Absolutely, and with time, and even as early as a child is born, there can be patterns that have restricted those choices, and how we move in our body and how we can't move in our body begin to affect how we're able to express emotionally, how we're not able to express emotionally, how our physiological functions operate and how they are impaired. So it's very difficult just to separate the physical from all the other aspects, because if one is involved, it impairs the rest.
Thank you. Thank you for saying that, because I think in our community and in the way we treat these children with behavioral issues, we don't talk about that enough. You know, we're so consumed with, well, the gut affects, behaviors, and it does. Diet affects behaviors, and it does. But we're so focused on that piece that we're forgetting that there's a whole human with this entire structural body that we live in. And we're hyper focusing on one thing and kind of losing sight of this other. And, I would say, and I'm guessing you would agree, that at least in 30-40% of these children, the physical restrictions are one of the primary issues that then cause the digestive issues and gut problems and bacterial changes and this and that. And I think that that's something that's not emphasized enough, because people go, I live in this world. So people come to me they've done all of these fancy tests and thousands of dollars and like stool testing and this testing and that testing, and they've treated this bacterial imbalance and they've done all of these things. And, at certain times I stand back and I'm like, well, what came first? What was the first issue that caused this child to be imbalanced, which then may have led to all of these other things? And I would love for you to touch on, so when you say there's the lack of freedom in movement, and this could come from birth, what do you see in children who have a traumatic birth, prolonged birth? Like, how do those babies show up to you? Because I've learned to see it, but I'd love our audience to hear from you what you see.
Well, I've had the privilege of working on newborns, and then seeing those newborns develop into children, and I've been in practice long enough that those children have had children. So I've been able to see this progressive development. Children have an innate sense to self-correct from trauma. Just nature's ability to self-correct with crying. There's an external pressure in the cranium with suckling. Excuse me, an internal pressure. There are membranes inside the head, the reciprocal tension membrane system that help to redirect bones. There's the instinctual stroking of the mother on the baby's head that is cross-cultural, that helps to normalize any imbalances, structural imbalances. But sometimes the forces of birth overwhelm the child's ability to self-correct. And that's when someone like myself, a pediatric craniosacral therapist, comes in. Sometimes the forces of birth, or even after birth, overwhelm the child's emotions. And ideally, when a baby comes into the world, it's able to engage with the mother, engage with the environment, bond with the mother, have vocalized facial expressions, those things that endear the mother to the child to the mother, create the bonding. Sometimes when the forces of birth are so great, or the conditions around the birth are not optimal, instead of being able to socially engage in that way, which would be optimal, a child might devolve into a less evolved way of dealing with stress, which is more the fight or flight. You could have a very agitated baby, a very colicky baby, a baby that has difficulty sleeping, a baby that may have difficulty bonding or have successful breastfeeding. And sometimes because a baby doesn't have the ability to flee or fight, often in extreme situations, a baby can devolve all the way to a parasympathetic withdrawal, dissociation, shock, immobilization, freezing, depression. And it's often misdiagnosed by the parents and the friends of the family as this is a really good baby because the baby's sleeping a lot, it's not crying a lot, it's just very quiet, and people are patting the parents on the back for having, excuse me, such a wonderful, calm baby. And it's not till the child perhaps gets into school, age 5, age 6, that these affects, these autonomic set points that children can get stuck in, begin to show as they begin to interact with other kids. And so what may have appeared as a very calm, relaxed baby, maybe now a child that has difficulty interacting or goes into depression and withdrawal and responds to stress by shutting down. So the goal of the work is really to create that choice, not that any one of these states is bad, but we don't want a child to be stuck in any of these states. So to be able to cycle through them quickly.
And it's so fascinating, the things that we just presume are normal because we don't know what else to call them, right? We say, well, colic is normal. The baby that's fussy is normal. And, one of the things that I've been humbled enough to see, I think thanks to, working with wonderful people like you and having my osteopathic school background, is I'd say in at least 20-30% of the kids that I see that are having anxiety or having whatever else they're labeled with, when you go back to their birth history, it's almost to the T. Once I see a pattern, it's like, were they colicky? Yes. Did you have to bounce them all the time? Yes. Did you have to sway them before they can fall asleep? Yes. Did the baby only fall asleep on you? Yes. Did they have trouble breastfeeding? Yes. And, it's like, almost like clockwork. Every time there's a certain pattern, there was Pitocin, they had to use vacuum, or mom was pushing for 30 something hours. And, as soon as they check off baby was colicky and I go and ask, it's every time the same scenario. And, pediatricians are not trained to look for these things, right? Pediatricians, their job is to make sure the baby isn't deathly jaundiced, they're gaining weight, they hit certain milestones, and, they say, well, colic is normal. It comes around a few weeks of age. It usually goes away at like a few months of age, and you just live through it. But the part that's so fascinating is, at least in what I've seen, is these are also the kids that like have a hard time going in their car seats. They have a hard time being in certain environments because they're never settled in their own bodies, right? So that statement that you made about them having the freedom, these are children that truly are never comfortable being in their own body. They don't have that freedom to be able to be in different positions. And one of the things that I sometimes see when I examine the newborns is like the baby is curved, like they always curve into a certain position. And when I look at them, I'm like, have you ever noticed that she just kind of prefers to lean to the left? And they're like, yeah. Every time we look at her, she's just kind of scrunched like that. And it's all part of this, that they're just stuck.
Yes.
They're just stuck, but we call it normal because we don't know that it's abnormal.
Right. And often children, infants and children, and even adults with birth-related injuries, will go further into a pattern in times of stress. Having had the privilege of working with newborns, I see patterns that are present, that persist, that I see in adults. Just most birth presentations the last 2 months in utero, because of the size of the liver on the mom's right side, the child is often, the left side of the child is directed to the mom's spine. And for those 2 months, the left side has pressure and the right side doesn't. So it's asymmetrical. Excuse me. And for vaginal delivery, the 3 most exposed areas that they can get torqued is the left hip, the left shoulder, and the left cheekbone. And often when adults come in, children or adults come in with low back pain, sacroiliac pain, it's usually on the left side. The left hip gets drawn back, the left leg is functionally shorter, there's an asymmetry. The left shoulder gets pulled down, the first two ribs get pulled up, the head begins to tilt. The left cheekbone often becomes less evident, the left eye often a little smaller and higher. And if we take flashcards to even fashion models, we could see the asymmetry. So these are things that are present, and we can, if we catch them early enough, we can begin to self-correct. And at the very least, we can work with it so it doesn't become a progressive structural deficiency and leading to functional deficiencies.
Wow. That's amazing. And I'm guessing some of the tightness in the cheek and everywhere else would be part of the reason why these babies can't feed.
Well, part of the reason, and certainly there's more drag on the left TMJ, or there could be hypermobility, there could be tightness, created by that. Yes.
Let's rewind back a little bit, if you don't mind. So you actually trained with Virginia Rolfe. So the
Rolfe, yes.
Oh, sorry.
I never trained with her. It was because of her that I came across Rolfing, but I trained with all of her. She actually passed away a year before I began my training. So I trained with each and every one of her students who became the master teachers of the Institute.
Got it. And then from there, you also worked with Dr. Upledger, with a lot of other masters.
Yes.
Who have basically created the world of craniosacral. So the people that created some of these were either your first or second level teachers.
Yes, I was so fortunate. Back in the day, the early 80s, I was able to work with Dr. Upledger for weeks at a time, sometimes 6 weeks, just he and I, 9 sessions a day, 5 days a week.
Wow.
It was a great experience. And to have the opportunity to work with these masters, even at an early stage of their teaching, or some with towards the advanced stage of their teaching. I've been very fortunate.
What were those experiences like? Because I'm guessing not everyone has had a chance to, train with masters like this.
It's interesting. What I find with masters is they need to carry the torch. They need to hold on to their vision and be so charismatic about it to pass it on to others and pass along the enthusiasm. And I think that the advantage of working with so many people, so many wonderful, generous, kind people, is beginning to take what's true for oneself as a practitioner and begin to drop other things away and create the work for oneself. And I'm appreciative of every single teacher I've ever had, and it's helped to mold me. But it was never my vision to be in the footsteps of any one great teacher, great person.
And now you have become the great teacher.
Well, hopefully people will take from me what's true for them and leave the rest.
But you have, I mean, you're being very, very humble, and I appreciate that. But you've trained a lot of people, especially in the domain of pediatric craniosacral.
Yeah, I have, and when I started treating children, really becoming involved with the study of treating children. In that, when I treated adults, and they would eventually bring their babies in, and I would kind of treat them like just little adults, like junior adults. And it's clear that they had their own structure, their own nervous system, their own history, their own biography that's different than an adult would be coming in. So I started doing research and found how little at the time was available. And a lot of things I actually had to have translated from the French or the German. There were some wonderful things coming out of osteopathic colleges, but at the time, not a lot. And so it really set me on this course to really delve into and see what was there, what was true, what was not true, and what was clinically important, and make the work my own and pass along that to other people.
Well, thank you for doing so. We need a lot more people like you out there.
Thank you.
Help us understand with all of this training let's take this now to, we have these tools, we have these issues that potentially show up from infancy, birth, so forth. Can you help our audience understand how a structural issue in the cheek, the neck, the body, anywhere, how would that affect the nervous system? Because you touched on it early on. You said these children don't have a choice. They're stuck in fight flight. Why would something in the muscles, the fascia, which is the connective tissue, and I think when you said that reciprocal membrane tension, so we have these elastic tissues that are running. So how would restrictions in different parts of the body physically impact the nervous system and cause a child to be in a state of fight or flight?
Well, let's take the example of ventouse or vacuum extraction. That can be a wonderful procedure, and it can have, if left, it could possibly leave ramifications that, if left untreated, could create conditions that would be with the individual the rest of their lives. As the vacuum is placed on the back of the head, it sucks not only the child's skin, but bone and underlying tissue, and even brain organelle. It can kink what's called the aqueduct of Sylvius, the channel between the third and fourth ventricle. So it interferes with the flow of cerebral spinal fluid, interferes with the normal pressure that's created in the head. It could interfere with the position of the bones within the bones of the occiput itself. at birth, the occiput is 4 separate bones. And each of those bones form a margin of the foramen magnum, where that hole where the brain meets the spinal cord. So any distortion of any of those bones within the bones at that time can affect the pressure of the spinal cord. It can also affect where the cranial nerves flow through the brain into the body, particularly the jugular foramina on either side of the spinal cord, where the 9th, 10th, and 11th cranial nerves enter, and also the jugular vein. And if the 9th cranial nerve is involved, it can affect the swallowing, eating. The 10th, the vagus nerve, can affect the autonomic nervous system. It can affect the ability to regulate our heart rate and lungs, and below the diaphragm, digestive issues, sphincter issues, reflux issues, colic issues, things that might develop into more significant conditions as the individual grows. The 11th cranial nerve can affect the tightness of the neck, which can in turn affect the carotid sheath, which contains the vagus nerve and the cervical lymphatic chain, the carotid artery, the jugular vein. So these things can have an immediate effect, but then that effect become progressive with time, and we can go further into a pattern, and our organs and organ function can be affected, our moods can be affected, our ability to how we function in the world can be affected.
That's profound. It's amazing, and I really hope our audience takes this in. And one of the books I'll be referencing is Accessing the Power of the Vagus Nerve, because I think for the healing power of the vagus nerve, which you wrote the foreword to, and this is the world that you live in. I mean, God, I only wish people can really grasp the profound nature of this, because we gloss over this. Outside of little communities and pockets where an osteopath or craniosacral therapist is doing work and that community knows of their work, I'd say probably 95+% of this country and probably around the world have no idea that there are these connections. Yes. And in medical school, like I'm lucky again that I went to osteopathic medical school, but when we were doing anatomy, we were just looking at, oh, well, this nerve comes out and this nerve comes out, and physicians are just taught, okay, like these things are there, except we're never taught like how they come together, and only the osteopathic background gave me this ability to start seeing these connections.
Yeah. And when parents ask, should my child come in, or, does my child need to come in for sessions? I often say that not every child needs treatment, but every child should have the benefit of evaluation. Every child should be able to see someone like yourself, someone like myself, or colleagues in our field that can evaluate a child. And if we can get to a condition early enough, we can forestall personality and behavioral issues, learning disabilities, sensory issues, structural issues that become logarithmically engaged as we get older. So as William Sutherland, the founder of cranial osteopathy, I'm paraphrasing him, but he said, as the twig is bent, so grows the tree. And so if we can get to conditions early enough, it can forestall these things that can be with us throughout our entire lives, and even become more accentuated with time, almost like a sauce that gets reduced. There's nothing there that wasn't there at the beginning. It just becomes more accentuated as we get older. So that would be our goal. There's a wonderful osteopath that had once said that who treats children. And she said, why do we treat children? And she said, we treat children because when we look at a child, we never know who that child could be. And when we look at an adult, we never know who or what that adult could have been. If they had gotten treatment, we don't know who they could have been if they had gotten treatment. So
that's beautiful. I love it, and that's why I'm doing the work that I'm doing, and really wanting to get the message out to all of these other people, because everything is tied together, and we don't know what'll happen to a child, if they have these limitations. And I'd love to touch on these things, because you said a lot of really important things, because I think for you, it's just so common knowledge, but for most people, probably not. The sensory issues. So children can have learning disabilities, children can have sensory issues, they can start developing behavioral problems. And I'd love to unpack all of this, because there's so much wisdom there. Why don't we talk about the sensory issues first? One of the things that's been so interesting is trying to see, in my clinical practice, seeing how the pieces come together for these children, and how after some good treatments, all of a sudden issues that were there are no longer, or are markedly improved. So how do our eyes, ears, and other senses, how are they impacted by these physical restrictions?
Great. In the normal birthing process, in the most gentle, perfect birth, there's still asymmetrical ringing and compression, turning of the cranium, particularly in the mid-pelvis. And so bones can get shifted. We have 12 cranial nerves. 6 of them are in some way involved with sight or movement of the eyes or eyelids. And so if the bones don't go back entirely, the passages and the function of the cranial nerves can be impaired. Our eye movement, our ability to adjust to sight, so many things. So things like strabismus, or the migration of the eye, double vision, things like that can be, and are most likely an effect of pressure on the cranial nerves, or asymmetry on the membranes affecting the cranial nerves. So again, as we normalize structure, function will follow. There are 7 bones that make up the orbit of the eye. And if there's any distortion, even distally, it can affect the orbit of the eye. And it could even affect the visual plane, so a child will have to turn the head, and it can create eventually scoliosis with time. So many things. With the ear, we know that during the birthing process, the left side of the head, in about 80% of the presentations, is going to have more pressure. Even as a baby is pulled out, the pulling can be asymmetrical. Even with the most caring obstetrician and the most gentle birth process, it will be asymmetrical. And at that age, the baby's head, the baby's cranium, is like, the cranial bones are like icebergs floating in the sea of membrane. It's just fluid and membrane with bones floating in it. Things can easily get displaced, even with the most caring birthing climate. So the left side can have more drag on the temporal bone. The temporal bone can internally rotate. The eustachian tube, which is 1/3 in the temporal bone, 2/3 towards the inner ear, can close off. It can affect the child's ability to equilibrate the internal pressure of the head for the outer environment. It could affect the cranial nerves, creating hyperacusis with ultrasensitivity to sound. So many things.
So just to translate part of what you said, so for some people, some children, the bone can actually kink off the ear tube that actually takes the pressure out of the ear and drains the fluid. And that's why some of these kids keep getting ear infections on the same side, yes. Right? Because that eustachian tube is never open, and it's always or not always, but the majority of the time it's the same side. And what, if I understood correctly, what you also said is that there are nerves that control certain muscles that control the ears' sound conduction.
Yes.
And that sound conduction could be dampened if the muscles are tightened or loosened, or it could be all the sound could just be allowed to come flooding into the ear. And that's why with some of these kids, they literally can't handle the sound in their environment. So these are kids that can't go into playgrounds because there's too many kids screaming. Families take them to parties. They're there for half an hour, and this is like an 8-year-old, 10-year-old, and they just have to get out of there. They can't go to fairs. They can't go to movies. And people just look at them and say, well, you're strange. No, this kid isn't strange. They have something happening when they literally cannot control the sound volume that's going in. So it's like watching a movie full volume all the time, and they can't shut it down. And it's because there's a bone out of place or something has happened to create tension or restriction in the head.
Absolutely. And I mean, we could talk about this for hours because which I won't. I didn't want to scare anyone. But it's such an exciting topic because if we can get our hands on these conditions, on these issues, we can have such beneficial results. When the muscles are out of imbalance, those that affect the eardrum, particularly the stapedius muscle, it's innervated by a slip of the seventh cranial nerve. And if we can help balance the cranial nerves, it can take the pressure off of that muscle. And it's kind of, that muscle's almost like a rubber band, that the tighter we pull the rubber band and we pluck it, the higher the sound. So these childs are not only hearing more sound, but it's coming at a higher pitch. And so it's disrupting their nervous system and affecting their ability to socially engage.
Wow. So they may also not be hearing sound normally. Like right. they actually have a distortion in the quality and frequencies of the sounds they hear.
Exactly, which can affect learning, because if they're not hearing mid-range, in particular, which would be speech, or they can't distinguish a voice in a crowd, it can really impair them for the rest of the life.
Wow, that's crazy. That's crazy. We don't talk about this very often, do we? And, these are things that, again, we say are normal. Oh, Johnny's a little weird. Sally just has some limitations, and we just gloss over these things because we don't know what else to do with them, right? We put these kids in speech therapy. We put them in social skills classes, but we don't stand back far enough and say, why in God's good earth is this child having this issue in the first place? So if you've got the child that has a bunch of restrictions and their eyes are not moving efficiently, they may lack depth perception. So they literally can't know where they are in space. They have trouble reading because their eyes can't track well on the page. And I've been honored. We've had two brilliant optometrists, one a neurooptometrist, another developmental optometrist that's trained in neurooptometry, actually talk about how critical all of these nerves are in terms of the eye movement. So if we have these issues, basically the child cannot trust their sight in their experience of the world. If you add to that, or in place of, if the ears are not working well, you can't trust what you're hearing. So with these and other distortions, these kids are literally lost in the world. And they can't understand things because literally the way their brain takes in information is distorted.
And putting another fine point to that is that if one side is affected more than another side, the brain is getting conflicting information. So one ear may be getting one piece of information, the other ear another, and it can be very confusing, particularly in the developmental brain. Wow.
And a lot of times, because of this, they don't have just learning issues. They start acting out. They start having behavioral issues because it's every day is frustrating for them.
My experience is that often with cranial issues, there can be a discomfort but a child can't put their finger on it as they could like an elbow that's hurting or a finger that got hurt. And so often children will create focalized pain. They'll get into accidents more, or they'll bite their finger, they'll bang their head, they'll pull their hair to create a focalized pain that they can identify. So it's easier to have a pain that you can point to than a general discomfort that could be a distortion of the head where there's no one focal point. So they're just in discomfort, so they create issues, whether it's physical issues or behavioral issues, something that can be focalized because there's a general malaise because of the cranial distortion.
Wow. So there are children that will hurt themselves because ultimately they need that pain to help them feel grounded.
Exactly. It focalizes something that is unfocalized, and at least they can point to it, they can talk about it, it can be dealt with, or that could be the problem. But it's almost intolerable to have this discomfort that may be systemic in the structure, the system, that they can't point to, they can't tell anyone about.
Yeah. And, if you've had that your entire life, if that's your only experience of life, right? If this whatever discomfort, this distortion, because usually they go hand in hand, has always been there, you don't know any different, right? These children don't know any different to say, oh, my neck is suddenly hurting, or this is uncomfortable to me, because this has been their experience their entire life. They can't say, oh, I can't see well, or I don't know where things are in space, because a lot of these kids can see with normal visual acuity. It's just the way they process space and vision is off. They can't say, hey, if something is off in my environment, to them, this distortion is normal.
Yeah.
Which is part of what makes it so sad.
Yeah. So if I had an overall statement that I could carve over my treatment room door, it would be normalized structure and function will follow. And it's something that's very tangible. We can get our hands on things. If we get them on, as I mentioned early on, we can help prevent these things from progressing into adulthood. And we can, if we look close enough, we can see these birth-related injuries in adults we meet. I have a little test I give to when I teach to, and I could tell, I say to the students, we can tell in just a few moments if you're more in a sympathetic fight or flight set point, or more of a parasympathetic withdrawal, dissociation, freezing, shock. And may I go through that just for...
Please.
I'll make it a brief, but if you could imagine it's a mid-afternoon, you're at home, and the world is quiet, and the doorbell rings, and it's a postman, and he comes with a certified letter, and it's from the Internal Revenue Service, and it's a very thick letter. And someone who's developed fight or flight affect set point early on in their life, maybe as early as birth or even in utero, may be, be in the fight or flight response and open the letter and want to call people immediately, take names, get to the bottom of it. Someone who handles shock, whose ability to fight or flee has been defeated early on, their response to stress may be to take a nap, to get something to eat, to maybe watch TV before they open the letter. So the students in the class often begin to separate, saying, I probably just want to take a nap, or, I'll leave it there on the table by the door for a while. Other people say, no, I just rip that open. So things that start early on can persist, and it affects not only how we handle certified letters from the IRS, but how we handle relationships. And in relationships, sometimes we're dealing things after the fact, and we deal with the effect rather than the cause. And that if we could get to the cause early enough, it would be a godsend.
Yeah. And would you say that ultimately that needing to take a nap is because they have no reserve left?
Possibly, yes, but also it's how they handle stress. So a baby whose ability to socially engage and even the ability to fight or flee have been defeated, just overwhelmed, that they'll handle stress by withdrawing, by turning away, by freezing. You see it with newborns and young in the treatment room if they have difficulty crossing the midline, or orienting towards a resource like their caregivers, their mom or their dad or both. Again, these are often the babies that are labeled good babies, quiet babies, until they realize that the people around them realize that it's how they're handling stress by dissociating, withdrawing.
Interesting.
And it often causes depression. And these states that can be created early on can even determine what illnesses we may get later on. Not meaning to overstate the case, but when we're in a parasympathetic withdrawal, we have a very low cortisol level. And cortisol acts as a brake on the immune system. So in these depressed, withdrawn, dissociated states, the brake is taken off of the immune system when we can get autoimmune conditions, rheumatoid arthritis, Crohn's disease, chronic fatigue. In chronic hyper fight or flight stages, where cortisol is high, the immune system is depressed and people can get colds more easily, illnesses more easily. And many of us have experienced that when we've had a long period of stress, we may catch cold more easily.
Yeah.
So it may determine even decades later what illnesses show up.
Wow. And these are the things that are so incredibly fascinating about the human body. I mean, the miraculous connections that are there. And I have a little diagram on Wholistic Minds that talks about how everything is literally tied to everything, because you can have these cranial nerve restrictions, and then next thing you know, the adrenal glands, after pumping out cortisol for a period of time, tire out. And, I'm not talking a 35-year-old. I see this in 8-year-olds. I see this in 10-year-olds where their adrenal glands are completely stressed out, and there's tests that I can run that actually can show this. But the amount of cortisol that's coming out relative to that adrenal gland functioning is completely depleted. I see kids come in and they have weird growths of bacteria like Clostridium. And people are so focused on the Clostridium, because the Clostridium can create all of these toxins that can cause the nervous system to become irritated. But it turns out that Clostridium and Candida and some of these other microorganisms overgrow when there's a stress response. So you could have the cranial nerve imbalance that goes all the way back to birth that has caused this child to be in this state all this time, and then that state has now caused these other distortions, which then actually come back and compound the issues and make all of these issues that much worse. But part of why I'm so happy to be talking with you and for you to be sharing this wisdom is what I see is so many people are focusing on the gut and the Clostridium or the Candida without saying, well, what happened that caused these to overgrow? And if you don't take care of the cranial nerve restrictions and you just treat the Clostridium, well, guess what? Everything is going to go back to where it was because that primary issue was never taken care of.
Right. Exactly.
Anything else that you think our audience should understand about the cranial nerves, the vagus nerve? Because we've kind of touched on this. So just to make sure that the audience is clear, the vagus nerve is this massive nerve that goes all the way down into controls our heart, controls our gut. And it's basically the main regulator of the rest and relaxation system.
Right. It's developed later in our evolution as humans. And the ability to regulate above the diaphragm our heart rate and our lungs together, moment to moment, many, many times each second, is far more efficient than the ancient way of adrenaline, which was metabolically expensive and stayed in our system long after the experience was over. So when it was over, it wasn't over. With a healthy vagus nerve and autonomic nervous system, then things can react and it's over. And sometimes people who experience high anxiety have a dysregulated vagus nerve, autonomic nervous system. Below the diaphragm is the more ancient, the dorsal vagus nerve, which affects digestion. And then 80% of the vagus nerve, which isn't really talked about, is afferent, or it brings the information back to the brain, combining with other cranial nerves. So it tells the brain what's going on in the body so the brain can then react. So if that 80% of the vagus nerve is affected, the brain has misinformation and can't react appropriately. So it's incredibly important, but not isolated. So the vagus nerve, we want to think about treating it independently, but it's part of a whole.
Wow. So one, if there's an imbalance in this nerve, it could affect the heart in a way. It could affect the digestion. And I see this in a lot of the babies. They have weird cases of reflux that, for instance, don't respond to diet. And in the older children, it also causes them to have either bouts of constipation or weird cases of diarrhea. And because the vagus nerves ultimately controls the enzymes that go into our gut, it affects the bile flow, right? Which into the intestines, which impacts digestion. And if those two pieces are off, you can't digest food. So you can get the leaky gut, you can get all of these issues, food reactions, food sensitivities that are then another can of worms, but all of that could have originated from an imbalance in the vagus nerve.
Exactly, which could have originated in an imbalance of the structure.
Wow. And then if it just so I understand and our audience understand what you also said about the afferent. So all of this information with this big fat nerve comes back up into the brain, and that input coming back up into the brain can also be affected if there's a restriction. So it's like the channel on both sides gets messed up.
That's right. That's right. Not only the efferent going away from the brain to act on the lungs, the heart, the diaphragm, everything suspended from the diaphragm, but also everything going back in, giving the brain what information it needs to deal with. And if that information is degraded, then the system begins to fail.
Wow. Now, for many people, they can't imagine how a treatment can somehow restore functioning or treat or rebalance these things. So how, because you don't pop, you don't crack, you don't do anything aggressive. How is it that through simple touch, and just so our audience can understand, we're talking like barely you touching the skin. You're not poking, you're not thrusting, you're not doing anything. How is it that with such light touch, you and other healers like you can actually rebalance these things?
One of the things that I appreciate about pediatric craniosacral therapy is that I think it's cranial therapy at its finest, because there are still bones within bones that can move easily. As a child gets older, we treat the forces within the bones that can be created after the bones within the bones begin to fuse. But with this light touch, our goal is to meet and resonate with the child, with the tissue, and without adding extra force. But it's almost like, if you remember those spring locks where you press it down and the lock releases. If you do it too lightly, nothing's going to happen. If you do it too strong, it's just going to compress the system. But if you do it just enough, it unlocks the system. So we want to allow the body's self-corrective mechanisms to be able to operate. And so that's the goal. We're working with the child rather than on the child. And we're helping to normalize the bones, the sutures, the underlying membranes, and we're helping to balance the autonomic nervous system.
So when you say with just enough pressure, so are you, just for the sake of our audience, I hope I have a decent idea of what you do, but for our audience, so you put pressure and then you just move stuff, you put enough pressure to get something to release. Can you help the audience contextualize like how it is that your hands go in there, and one, how do you feel all of this stuff? And two, once you feel it, like how do you get it to move? How do you get it to shift? Because I think for most people out there, they can't even conceive that this is possible. And I mean, I've seen this so many times that I'm 100% sure that it's possible, and that's why we're having this discussion. Because in my own heart, I know I've seen it in my own daughter, I've seen it in myself, I've seen it in hundreds and hundreds of children. But I'd love to have our audience understand from you, how is it that you can feel these tensions and these restrictions, and like physically, what do you do to get things to move? If you can help us understand in some kind of
and on a gross anatomical level, one can see the symmetry of the eyes, the promise of the frontal bones, parietal bones, cheekbones, nasal septum, position of the ears, feel the sutures and the overlapping of the sutures. On a more intrinsic level, one can feel the gentle movements of the cerebral spinal fluid and feel the symmetry and asymmetry that may be corrected. As one is in this field long enough, one begins not to focus on what's balanced, but almost what's out of balance. It's almost like if you're just in nature and you hear a little something in the background, your focus is on what is out of balance, what is different there. So it begins to become easy to see where the dysfunction may be. And the amount of pressure can vary, because if there's something with infants as opposed to adults, often the corrections are very direct corrections. If something's low, you could move it high. Where adults, you may do what's called indirect correction, which is actually going into the pattern to help release it. Almost like a drawer that's getting stuck, you may want to push it in a little more to release it. But with children, it can be with infants, it can be very direct corrections.
And when you say direct corrections, you're not like popping a bone back into place.
No.
Because I think when someone hears that's what they may be thinking. That's not at all the case. You're literally putting the lightest touch in just the right place, and that light touch actually gets things to shift.
If you could imagine, and again, stop me if I'm just going on, but if you can imagine that including the physicality of the child, there's an energetical field, and including the physicality of the therapist's hands, there's an energetical field. Those two fields can merge long before there's actual touch. And then the child begins to tell you by its actions, by the energy, how close one can get, how close one can move. Again, moving too fast, too quickly could drive a pattern deeper. It's almost like if you're walking in the woods and you see some deer, if you run up to them, they're just going to run away. But there's something, as you approach slowly, there's something about the feedback from the deer that could say you could take another step. And then you could imagine that almost that as you have your touch, that the skin, the muscles, the bones begin to disappear, and it can actually meld with the bone, with the child's bone, with the child's membranes, with even the fluids the child's bones. And so the movement is not something that is on, but something that is with. And you stay with it until there's movement that's invited. So it's seldom imposing. You stay with it, and often the body begins to unwind. Sometimes it just needs that little extra energy from another person to begin the completion of that normalization, that balancing. Sometimes there's mild direction, and then you wait, you see the response, and you wait, and if it allows you more, just like the deer can let you come in a little bit more, then you go further and further. And sometimes it means doing less of what we're capable of doing. You know, a therapist could say, "Oh, I can fix that sphenoid bone, you know, in one session." Well, it may do a disservice. And so, depending on the child, depending on the overall structure, depending on the response of the tissue, often one chooses to do less that session in the interest of trust and safety.
Got it. So you really follow what the body is trying to do, and you kind of follow its lead and just go take things as far as is comfortable, really, for that child. And it may be an infant, but you're sensing that.
Exactly. And there's so many ways a child will let us know when they're getting overwhelmed or overstimulated. And then you begin to adjust your work, perhaps adjust the environment, make sure that the child is fully resourced during the session by being able to see the parents and all.
And I consider you and others like you truly gifted because, as a student, I work with some cranial osteopaths, and within a month or two, I realized like I could probably work really hard to get my hands to become average in their sense of touch. But there are masters like you that you can literally put your hands on someone and just feel tension patterns in all different parts. And as one example, one of the teachers that I had years ago, I would be on the person's ankle trying to feel something, and they would be on the base of the skull. And he would say, to the patient, he'd say, "Did you twist your ankle a few weeks ago?" And they're like, "Yeah." And my hands are on that ankle. And they're like, "Yeah, I twisted it and it's been hurting since." And they made no mention of that when they came in because they came in for something else. He's like, "Yeah, your ankle is out of place and your ankle is causing your neck pain." And like he literally could feel the tension going down to the ankle by being on the head, which to me was like, oh my God, like how is this possible? And there I am on that ankle and I could barely feel anything. But I think that's the gift that people like you have. You have such a amazingly refined sense of touch that you're literally picking up on so much information by just putting your hands on this human being, small or large, and through that deciphering what feels off, what is tight, what feels good, and where you can go with all of that to start rebalancing things.
Yes, and there's no substitute for experience, but one of the great joys of my practice is that when a child comes in, and I feel that there could be continued work that could be done daily, it's a tremendous joy to teach the parents what to do. And in a brief time, a parent can become very proficient if there's a condition that would really benefit, an unusual condition would benefit from daily work, rather than have the parent bring the child back repeatedly. I think the sweetest care of all is done within the family unit. And if I could teach the parents to do something, fairly simple but extremely effective and important, that would be my goal.
That's amazing. What things do you teach parents? What like just massage or?
Well, let's say that with uterine contractions, it's really the sacrum even more than the head that may get the brunt of the uterine contractions. And at birth, the sacrum is 5 separate bones. It can be like popsicle sticks that are out of alignment. Well, you can get a lot done with the first session, but you could teach the parents just to imagine that as they have their hand under the sacrum, that their skin, muscles, bones begin to disappear. And it's almost like as if the 5 bones are sitting on a lake, just and letting it rebalance. And, or if the child has anxiety, let's say it's a child beyond infancy, to help to downregulate the anxiety with what is traditionally called CV4, but my sense, it helps to downregulate the production of noradrenaline in the fourth ventricle, the product produced by the locus coeruleus. So parents don't have to know that science, but if they can visualize what their hands are doing and where it may be directed towards, it helps to balance those organelle of the brain that may be overactive or out of balance.
Wow, that's incredible. I think we could talk for hours in terms of all of the different techniques that are possible and all the different things that can be done. But my God, I don't know. I'm just thankful that you're sharing all of this. What are other things that you think parents should know about the work that you and others like you do?
Well, first, that it's gentle, and again, the main goal is trust and safety and establishing choice. So it's not imposing what a therapist feels that the child should be or how the body should be, or imposing some structural technique that may be overwhelming or overstimulating to the child. So it's gentle. It's rare that a child would cry during a session. Perhaps if it needs to be changed or is hungry would be the two most common things, but it would be unusual for a child to not react. The child will react very well in the session. And again, the therapist is careful not to overwhelm, overstimulate. The therapist offers the child respect. It's always a conversation, even if it's in the therapist's own head with the child. Do you want more space here? Do you want more freedom here? Do you want more movement here? And sometimes the answer is no, even silently. And if the answer is no, it's no. So it's a gentle process. And even in extreme, if a child is having extreme emotional affect, it is because they're not able to socially engage. And they can't socially engage if they don't have a feeling of trust and safety. And the feeling of fight or flight, or the feeling of parasympathetic withdrawal and dissociation, shock, maybe the only way that child, even a very young baby, the only way they feel they can be safe on this planet. So in the treatment room, if we can consider it a laboratory where we can offer trust and safety, where they can begin to feel social engagement, more engaging with the caregivers, with the environment, able to cycle through those other set points more freely, well, we can't expect that to be like a light switch, that they immediately come out and things are 100% different. But being in a laboratory and letting them experience that in the treatment room, they take some of that out into the real world. And they can begin to resource what was done in the treatment room out there in the world. So, yeah.
You help them reconnect for perhaps the first time.
Yes, that would be the goal.
Wow. That is a blessing. That is a blessing. And, my God, like when we look and think of how many children are not connected, how many children are struggling. And I mean, that's the main reason why I do what I do and why I created Wholistic Minds. And I think why we're having this discussion, because these children are labeled as, mentally delayed. They're labeled as, autistic. They're labeled as having an anxiety disorder, OCD, whatever labels they're given. Some of them are put on medications because the children just can't control themselves and they're getting in problem or having problems because of that. Some are not put on medications, but they come to see themselves as these bad people that are, incompetent, useless, whatever. And we have ways of helping them reconnect within themselves to then be able to overcome these things. Because children aren't bad by their nature. Children don't want to act out. That's one of the things that I've been humbled to see. Outside of social issues at home, most other children don't want to be bad. They don't want to act out. They don't want to be the child that's getting in trouble. They realize themselves that something is wrong, but they don't know what to do with it. And through the work of someone like you can literally help them reintegrate into their body. You can help them start feeling balanced again, or for the first time, I should say. And through that, the child can step into the world and all of a sudden start functioning differently. And it's been crazy. I mean, the things that I've seen where kids with behavioral problems, severe anxiety, severe ADD with these glasses, literally, like I had one case where the child, after one treatment, took off the glasses, is like, oh, I don't need my glasses anymore. And then had the best day of their entire life at school, in life. And I've seen these scenarios so many times over and over again that it's just like, oh my God, we need to help parents realize what's possible.
And the beauty is it changes the family dynamic. That when a child is acting out, the parents can act more defensively or offensively, but it's sometimes very difficult just to be with the child that's acting out. And when that begins to downregulate and normalize and balance and everything changes. Everything changes.
Literally everything within the home, outside, and within the child. Their own body changes.
Yeah.
Well, thank you. Thank you for being here, sharing your wisdom. I'm so grateful, and I'm sure our audience that's watching this is as well.
Well, it is a pleasure to be with you and a pleasure to speak with you. And I have a great deal of respect for you and what you do. And thank you for putting all of this together.
Well, I feel that it's my duty. Thank you. And thank you all for listening. This is Dr. K from Holistic Minds with Dr. Benjamin Shield.